Hello again. So this is part 2 of the kidney stone presentation, and just a few more details that I forgot to cover in the last video. And one of the things to watch for if you suspect that you might be passing a stone, besides having pain in the flank that kind of radiates around and down and out, is also blood in the urine. So sometimes you can have a pink tinge to the urine, sometimes actually bright red blood. For the guys, that's especially noticeable if the stone is passing through the prostate area. And so having a little bit of blood in the urine is potentially a sign of a kidney stone as well. Next, there's a few other sources of good stone-preventing phytates that I didn't mention in the last presentation. And some of those, I mentioned beans and grains, but also nuts and seeds. Nuts and seeds are incredibly healthy for you anyway. And basically, they already come prepackaged with nutrients that help with fat burning, and they also help with sustaining the appetite, so to say, as far as like you eat the nuts and then you don't get like these sugar crashes, and you can go through the day without having these cravings as much for foods if desired. So nuts and seeds are good for many things as well. Also, diet that's very rich in fresh fruit is also protective against stones. Lots and lots of fiber, because the fiber binds the things in the gut, and then you kind of poop out the not good things that can cause the stones. Magnesium, foods that are rich in magnesium, again, things like nuts and seeds, especially pumpkin seeds are very rich in magnesium, and sunflower seeds as well. Just again, get the unsalted version because the salt raises the risk. So unsalted pumpkin and sunflower seeds can be very helpful. And simply reducing the amount of animal proteins that are consumed, less hamburgers, less sausages, less animals in general, and that includes less chicken and turkey and that sort of thing. Watching out for some of the foods that are high in purines, so that's another ingredient that can cause stones. So yeast, for example, can potentially trigger stones. Sometimes we use something called nutritional yeast, and so if you're a stone former, just being careful not to have a lot of that. And also, there are some foods that are rich in oxalates, because the oxalate that's in the diet, excuse me, can bind the calcium in the kidney. So the oxalates go with the calcium sometimes and cause some calcium oxalate stones. There are some foods that are very high in oxalates. Those are star fruit. Those are a neat little fruit. You cut it and it looks like a little star. Beets are also very high in oxalates as well, so it can be very healthy, or if you happen to be a stone former on a high protein diet, then it might not be as good. And high doses of turmeric. So if you're doing Dr. Greger's daily dozen recommendation of a quarter teaspoon of turmeric a day, for most folks, that's okay. That's not going to trigger stones. But if someone's taking like 6 or 7 capsules of turmeric a day, you might consider backing down on that. And cinnamon is also very high in oxalates, just like the turmeric is. However, the oxalates are really tightly bound in the cinnamon and much more likely to be flushed from the body without being absorbed. So it's significantly less of a risk as well. And as mentioned, about 20 years ago, only 1 in 20 people were at risk for stone formation. Now it's about 1 in 11. And if you go through that list of things that are associated with stone formation, it's pretty easy to see some causality type stuff. Like our American diet tends to be much more rich in animal proteins than it was even 20 years ago in general. more sodas and things that are higher, put us just as a population at high risk, even more salt in the foods in general. So those are things in particular that can be troublesome as you want to go through life in a healthy way without causing kidney stones. So just double checking, Dr. Greger's volunteers did a great job of putting together their list. Dr. Barnard's group has a very similar list. They're mentioning that calcium intake from foods, as mentioned from the previous list, things like broccoli. Why is that important to have it in an actual whole food as opposed to a supplement? Well, because when you eat the piece of broccoli or other rich calcium-containing food, then it binds with those other ingredients in the gut, and instead of those other things being absorbed and then passed out through the kidneys and left to congeal or consolidate in the kidneys, well, the calcium will bind those things in the gut directly, and then again, you end up pooping it out down the drain, not a problem. Limiting the colas and so forth, and making sure to stay very richly abreast of the fluids is vitally important. Mentioned in the previous presentation that guys are about 3 times more likely to get stones than the females are, and also people who've had kidney stones already. So if you've had a stone, you have about 80% chance roughly of having a second stone within 10 years. So it's not an absolute guarantee, especially if you do some of these techniques and dietary, modifications, or being mindful of these particular foods in the diet. And then you can significantly reduce the likelihood that further stones are going to develop. Geography. So individuals in places where there's high temperatures and high humidity are at higher risk. Why would that be? Well, I live in Florida here. It happens all the time. People go out. They don't realize how hot and humid it is. They don't realize how much sweat and water they've lost, and so they get dehydrated much more easily in certain climates. And so being mindful is that. There are a few areas of nationality that also are higher risk, and not surprisingly, the so-called Western countries are much higher risk, mostly because of the dietary high-fat, high-meat diet that is very popular in such countries, as opposed to the countries where the plants tend to take center stage. Compared with normal weight persons, men who are obese, 33% higher risk for stone formation, where obese females have a 200% greater risk of forming stones as opposed to their less overweight counterparts as well. We describe the diet. Chronic urinary tract infections. That is a rarer form of stones, but what happens there is that there can be a little blob of infected material that kind of congeals and gets hardened and basically can block up the ureters and such. Sometimes these things are not visible very easily on CT scans. The ones that tend to get calcium, they light up very easily on a CT scan. The ones that are uric acid, sometimes they can also show up pretty well. But I've seen a few cases where the chronic urinary tract infections actually was in there with the urologist when they were going up and scoping and looking around in there. And it was stuff that you really couldn't see on the CT scan, but you could see it in like these crystals of, we call them staghorn calculi. It's basically, it's little masses of bacteria that get up in there and cause their own chronic stones, but also just frequent urinary tract infections. So again, if you're having troubles in that area, definitely go talk to your doctor with that. And then other things that can cause dehydration. For example, if you're having a lot of nausea and diarrhea and those types of symptoms, again, if you're having a flu, like flu is very common these days, because right now it's winter, it's cold, a lot of people are coming down with the flu. And so if you get very dehydrated from any reason, then the likelihood of causing the stones is much higher. as well. All right, so I think that rounds out the end of the ideas for the kidney stones. I'll put in the comment section, again, as usual, the references, in case you want to just read up a little bit more in depth. And of course, there are many more references available as well to those who are interested in hunting them down as well. But just to keep it light and simple and quick and easy, I'll give you just those 3 to start off with. So have a good night and stay healthy, and we'll see you next time. Thank you for watching. Bye-bye.